Question 1. The evaluation methodology shows a client with a history of polysubstance use who is experiencing significant difficulty maintaining stable employment due to attendance issues and impaired concentration. The counselor is tasked with developing an integrated rehabilitation plan. Which of the following approaches best reflects a comprehensive and ethical response to this client's needs? Option A. Implement a vocational training program without assessing the client's current substance use patterns or their impact on their ability to participate effectively. Option B. Recommend that the client address their substance use disorder independently through a 12-step program before engaging in vocational rehabilitation services. Option C. Develop a treatment plan that prioritizes evidence-based interventions for substance use disorder, while simultaneously incorporating vocational counseling focused on job retention skills and addressing cognitive deficits impacting concentration. Option D. Focus exclusively on vocational rehabilitation services, assuming that improved employment stability will naturally resolve the substance use issues. Correct answer is C. Develop a treatment plan that prioritizes evidence-based interventions for substance use disorder, while simultaneously incorporating vocational counseling focused on job retention skills and addressing cognitive deficits impacting concentration. Explanation. The evaluation methodology shows a client presenting with a complex substance use disorder that is intertwined with vocational challenges. This scenario is professionally challenging because rehabilitation counselors must navigate the multifaceted nature of addiction, which impacts not only an individual's physical and psychological well-being, but also their ability to engage in meaningful work. The counselor's judgment is critical in distinguishing between primary substance use disorder symptoms and those that may be secondary to or exacerbated by vocational stressors. And in developing an integrated treatment plan, the correct approach represents best professional practice because it prioritizes a comprehensive, person-centered assessment that considers the interplay between substance use and vocational functioning. This aligns with the CRCC Code of Professional Ethics for Rehabilitation Counselors, which emphasizes the counselor's responsibility to conduct thorough assessments, develop individualized plans, and advocate for clients' needs. Specifically, the ethical standards mandate that counselors gather sufficient information to understand the client's presenting problems, including their impact on vocational capacity, and to develop interventions that address all relevant areas of functioning. This approach ensures that the client receives holistic support, addressing both their substance use disorder and their vocational goals in a coordinated manner. An incorrect approach that focuses solely on the substance use disorder without adequately addressing vocational barriers fails to meet the CRCC ethical standards for comprehensive client care. It neglects the interconnectedness of these issues and may lead to incomplete treatment, potentially hindering the client's long-term recovery and vocational success. This represents an ethical failure to provide services that are responsive to the client's full range of needs. Another incorrect approach that prioritizes vocational rehabilitation without acknowledging or addressing the substance use disorder is also ethically problematic. This overlooks the significant impact of addiction on an individual's ability to maintain employment and can lead to relapse or continued functional impairment. It violates the ethical principle of beneficence by not adequately protecting the client from harm related to their substance use. A third incorrect approach that relies on a single theoretical model without considering the client's unique circumstances and the interplay of substance use and vocational issues is also a failure. Ethical practice requires counselors to be flexible and adaptable in their theoretical orientation, applying principles that best serve the individual client. A rigid adherence to one perspective, especially when it fails to account for the complexity of the client's situation, can lead to ineffective interventions and a violation of the duty to provide competent and appropriate services. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough biopsychosocial vocational assessment to understand the client's strengths, challenges, and goals. Second, identifying the primary and secondary issues impacting the client's functioning. Third, collaboratively developing an individualized rehabilitation plan that integrates interventions for substance use disorder and vocational rehabilitation. And fourth, continuously monitoring progress and adjusting the plan as needed, always adhering to the CRCC Code of Professional Ethics. Question 2. Research into the ethical considerations of rehabilitation counseling reveals a situation where a client with a progressive neurological condition expresses a strong desire to continue living independently in their home, despite recent incidents suggesting potential safety risks. The rehabilitation counselor is concerned about the client's ability to manage daily tasks and ensure their personal safety. Considering the CRCC Code of Professional Ethics, which of the following approaches best upholds the counselor's ethical obligations? Option A. Conduct a thorough assessment of the client's current functional abilities, understanding of risks and preferences, and collaboratively develop a plan that addresses safety concerns while maximizing independence. Option B. Advise the client that their desire for independence is unrealistic given their diagnosis and suggest they reconsider their living options. Option C. Document the safety concerns and wait for a significant incident to occur before intervening further. Option D. Immediately arrange for the client to move into an assisted living facility, as their condition indicates a clear need for a safer environment. The correct answer is A. Conduct a thorough assessment of the client's current functional abilities, understanding of risks and preferences, and collaboratively develop a plan that addresses safety concerns while maximizing independence. Explanation: this scenario presents a professional challenge because the rehabilitation counselor must balance the client's expressed desire for independence with the counselor's ethical obligation to ensure client safety and well-being, particularly when the client's decision-making capacity may be compromised. The CRCC Code of Professional Ethics for Rehabilitation Counselors emphasizes the counselor's responsibility to promote client autonomy while also safeguarding against harm. Navigating this requires careful assessment, open communication, and a client-centered approach that respects the client's dignity and self-determination. The correct approach represents best professional practice because it prioritizes a thorough assessment of the client's understanding and capacity to make informed decisions regarding their living situation. This aligns with the CRCC ethical principle of informed consent and client autonomy, ensuring that the client's choices are voluntary and based on a clear comprehension of the risks and benefits. It also reflects the ethical duty to protect clients from harm by exploring potential safety concerns in a collaborative manner, rather than imposing a decision. This approach upholds the counselor's role as an advocate and facilitator of client empowerment. An incorrect approach that involves immediately overriding the client's wishes and arranging alternative housing without further assessment fails to respect client autonomy and self-determination, violating the CRCC ethical principle of client independence. This approach assumes a lack of capacity without due diligence and can undermine the therapeutic relationship. Another incorrect approach that involves solely focusing on the perceived risks without engaging the client in a discussion about their preferences and concerns neglects the client's right to participate in decisions affecting their life, contravening the principle of client involvement. A third incorrect approach that involves delaying any action or discussion until a crisis occurs would be a failure to act responsibly and protect the client from foreseeable harm, violating the ethical duty of care. Professionals should employ a decision-making process that begins with a comprehensive assessment of the client's current situation, including their cognitive abilities, understanding of risks, and personal preferences. This should be followed by open and honest communication with the client about any identified concerns, exploring potential solutions collaboratively. If there are significant concerns about safety or capacity, the counselor should involve the client in seeking appropriate evaluations or support services, always aiming to maximize the client's involvement and control over the decision-making process. Question 3. System analysis indicates that a rehabilitation counselor is working with a client who has expressed significant frustration with the current vocational training program outlined in their individualized plan for employment. The client feels the program is not addressing their immediate financial needs and is questioning its relevance to their long-term career aspirations. The counselor has observed the client's engagement has decreased, and they are considering alternative approaches to move forward. Which of the following actions best reflects the systematic stages of case management and ethical practice in this situation? Option A. Focus solely on motivating the client to adhere to the existing IPE, emphasizing the importance of completing the current program as planned, and deferring any discussion of their concerns until after program completion. Option B. Terminate services with the client due to their expressed dissatisfaction and perceived lack of progress, advising them to seek services elsewhere. Option C. Initiate a collaborative discussion with the client to explore their concerns, reevaluate the IPE in light of their current needs and perceived barriers, and jointly develop strategies for program adjustment or alternative vocational pathways that align with their goals. Option D. Immediately revise the IPE to include a different vocational training program that the counselor believes is more suitable, without further consultation with the client, to address their expressed dissatisfaction. The correct answer is C. Initiate a collaborative discussion with the client to explore their concerns, reevaluate the IPE in light of their current needs and perceived barriers, and jointly develop strategies for program adjustment or alternative vocational pathways that align with their goals. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing client autonomy with the need for structured progress within the case management framework. The professional must navigate the client's immediate desires against the long-term goals established in the Individualized Plan for Employment (IPE). The CRCC Code of Professional Ethics for Rehabilitation Counselors emphasizes the importance of client self-determination and informed consent, while also requiring counselors to maintain professional standards and work towards achieving rehabilitation goals. The correct approach represents best professional practice because it prioritizes a collaborative reevaluation of the IPE. This aligns with ethical principles of client-centered practice and the systematic stages of case management, specifically the planning and implementation phases. By engaging the client in a discussion about the perceived barriers and potential adjustments to the IPE, the counselor upholds the client's right to participate in decisions affecting their rehabilitation. This also ensures that the case management plan remains relevant and responsive to the client's evolving needs and circumstances, fostering a stronger therapeutic alliance and increasing the likelihood of successful outcomes. This approach adheres to the CRCC Code's emphasis on informed decision-making and the counselor's responsibility to facilitate progress towards vocational goals. An incorrect approach that involves unilaterally altering the IPE without client consultation fails to respect client autonomy and informed consent, violating ethical principles. It bypasses the crucial collaborative planning stage and can lead to a plan that is not truly reflective of the client's needs or capabilities, potentially causing frustration and disengagement. Another incorrect approach, that of terminating services solely based on the client's expressed dissatisfaction without exploring underlying issues or attempting to modify the plan, neglects the counselor's ethical obligation to advocate for and support the client through challenges. This could be seen as abandoning the client and failing to adhere to the systematic process of case management, which includes problem-solving and adaptation. A third incorrect approach, focusing solely on the counselor's perception of the client's readiness without actively involving the client in assessing their own readiness or collaboratively developing strategies to address perceived barriers, also undermines client self-determination and the collaborative nature of rehabilitation. Professional decision-making in such situations requires a systematic approach. First, the counselor must actively listen to and validate the client's concerns. Second, they should refer back to the established IPE and the goals within it. Third, they should engage in a collaborative discussion with the client to understand the root of the dissatisfaction and explore potential modifications or alternative strategies that align with the overall rehabilitation goals. This process involves reassessing the client's current situation, identifying barriers, and jointly developing a revised plan of action, ensuring that the client remains an active participant throughout the case management process. Question 4. The performance metrics show a significant increase in successful employment outcomes for individuals with disabilities over the past decade, prompting a review of the foundational principles that have guided rehabilitation counseling practice throughout its history. Considering the evolution of the field, which of the following perspectives best informs the current ethical and effective practice of rehabilitation counseling? Option A. Dismissing historical perspectives on rehabilitation as largely irrelevant to contemporary practice, focusing instead on the latest technological advancements in assistive devices. Option B. Emphasizing the enduring efficacy of early vocational rehabilitation programs that focused primarily on matching individuals to available jobs based on their perceived limitations. Option C. Prioritizing the medical model's diagnostic and treatment strategies as the primary framework for understanding and addressing disability, with less emphasis on client self-advocacy. Option D. Acknowledging the historical shift from a deficit-based medical model to a strengths-based, person-centered approach that emphasizes environmental supports and social inclusion. The correct answer is D. Acknowledging the historical shift from a deficit-based medical model to a strengths-based, person-centered approach that emphasizes environmental supports and social inclusion. Explanation. This scenario presents a professional challenge because it requires the rehabilitation counselor to critically evaluate the historical underpinnings of their practice in relation to current ethical standards and client needs. Understanding the evolution of rehabilitation counseling is crucial for informed decision-making, ensuring that current practices are not perpetuating historical biases or limitations. The counselor must demonstrate an awareness of how past approaches, while perhaps well-intentioned, may have inadvertently excluded or underserved certain populations. The correct approach represents best professional practice because it directly engages with the historical context of rehabilitation counseling, specifically acknowledging the shift from a medical model focused on deficits to a more holistic, person-centered approach that emphasizes strengths and environmental supports. This aligns with the CRCC Code of Professional Ethics, which mandates that counselors provide services in a manner that respects the dignity and worth of the individual, promotes self-determination, and advocates for clients' rights. By recognizing the limitations of past approaches, the counselor can better advocate for inclusive and equitable services, ensuring that current interventions are informed by a comprehensive understanding of the field's development and its impact on diverse client populations. An incorrect approach that focuses solely on the efficacy of early vocational rehabilitation programs without considering their historical limitations fails to acknowledge potential biases and the evolution of ethical considerations. This approach risks perpetuating a narrow view of rehabilitation that may not adequately address the complex needs of all individuals, potentially violating ethical principles of equity and non-discrimination. Another incorrect approach that prioritizes the medical model's diagnostic and treatment strategies over client empowerment overlooks the fundamental shift in rehabilitation philosophy towards self-advocacy and person-centered planning, which is a cornerstone of modern ethical practice. This can lead to paternalistic interventions that disempower clients. Finally, an approach that dismisses the relevance of historical perspectives as outdated ignores the foundational principles upon which current ethical standards are built, hindering the counselor's ability to understand the systemic issues that have historically impacted individuals with disabilities and to advocate effectively for systemic change. Professionals should employ a decision-making process that involves continuous self-reflection and a commitment to lifelong learning. This includes actively seeking knowledge about the history of the profession, critically analyzing how past practices have shaped current service delivery, and integrating this understanding into ethical practice. When faced with evaluating approaches, professionals should ask, does this approach align with current ethical codes? Does it promote client self-determination and empowerment? Does it consider the diverse needs and experiences of all clients? Does it acknowledge and address potential historical inequities? Question 5. Which approach would be most consistent with the CRCC Code of Professional Ethics for rehabilitation counselors when assessing an individual's disabilities and limitations for the purpose of developing a rehabilitation plan? Option A. Employing a combination of standardized assessment instruments, client interviews, direct observation, and collateral information to gather a comprehensive understanding of the client's physical, cognitive, emotional, and vocational functioning, while also considering environmental factors and cultural context. Option B. Relying primarily on the client's self-reported difficulties and perceived limitations during initial interviews, assuming their self-awareness is sufficient for planning. Option C. Prioritizing the assessment of skills and abilities directly required for specific job openings identified by potential employers, without a thorough initial evaluation of the client's overall functional status. Option D. Focusing exclusively on the client's medical diagnoses and physicians' reports to determine their functional capacities and vocational potential. The correct answer is A. Employing a combination of standardized assessment instruments, client interviews, direct observation, and collateral information to gather a comprehensive understanding of the client's physical, cognitive, emotional, and vocational functioning, while also considering environmental factors and cultural context. Explanation. This scenario is professionally challenging because accurately assessing an individual's disabilities and limitations is foundational to effective rehabilitation counseling. It requires a comprehensive understanding of the client's physical, cognitive, emotional, and vocational capacities, as well as their environmental barriers and supports. The CRCC Code of Professional Ethics for Rehabilitation Counselors mandates that counselors conduct thorough assessments to inform service delivery and ensure client well-being. Failure to do so can lead to inappropriate interventions, wasted resources, and negative client outcomes. The correct approach represents best professional practice because it prioritizes a multifaceted, client-centered evaluation. This involves utilizing a variety of assessment tools and methods, including standardized tests, interviews, observations, and collateral information, to gain a holistic picture of the client's functioning. It also emphasizes the importance of considering the client's subjective experience and cultural background, aligning with ethical principles of respect, autonomy, and justice. This comprehensive approach ensures that interventions are tailored to the individual's unique needs and goals, maximizing their potential for successful rehabilitation. An incorrect approach that relies solely on self-report without objective verification fails to meet the ethical standard of due diligence. This can lead to an incomplete or inaccurate understanding of the client's limitations, potentially resulting in the provision of services that are not aligned with their actual needs or capabilities. It also neglects the counselor's responsibility to gather sufficient information to make informed professional judgments. Another incorrect approach that focuses exclusively on medical diagnoses without considering functional implications overlooks the core purpose of rehabilitation counseling. While medical diagnoses are important, they do not always translate directly into an individual's ability to perform daily living or vocational tasks. Rehabilitation counselors must bridge this gap by assessing functional capacities and limitations in real-world contexts. This approach fails to adhere to the CRCC Code of Professional Ethics, which requires counselors to assess the whole person and their environmental interaction. An approach that prioritizes employer-defined job requirements over the client's individual capacities and aspirations is also ethically problematic. While vocational goals are crucial, the assessment must begin with the client's current functioning and potential for growth. Imposing external job demands without a thorough understanding of the client's abilities can lead to unrealistic expectations and disempowerment. This approach neglects the principle of client self-determination and may not lead to sustainable employment. Professional decision-making in assessment involves a systematic process. First, identifying the purpose of the assessment. Second, selecting appropriate assessment tools and methods based on the client's presenting issues and the assessment's purpose. Third, administering and scoring assessments ethically and accurately. Fourth, interpreting the results within the client's broader context, including their strengths, weaknesses, cultural background, and environmental factors. And finally, using the assessment findings to develop a collaborative rehabilitation plan. Question 6. The review process indicates that a rehabilitation counselor is assessing a client with a history of substance use and a recent job loss, who expresses a strong desire to return to their previous high-stress occupation. The counselor has gathered initial intake information and observed the client's demeanor. Which of the following approaches to assessing the risk associated with the client's occupational goals is most aligned with CRCC ethical standards? Option A. Conduct a comprehensive risk assessment that integrates objective data, e.g., relapse indicators, support systems, with the client's subjective report of readiness and coping strategies, and collaboratively discuss findings to inform vocational planning. Option B. Focus solely on external indicators of potential relapse, such as past incidents, without exploring the client's current coping mechanisms or their perception of their own resilience. Option C. Immediately advise the client against pursuing their desired occupation due to the inherent risks based on the initial information about their history, without a more detailed assessment of their current status and protective factors. Option D. Rely primarily on the client's self-reported confidence in their ability to manage stress and avoid substance use in the demanding work environment, as their expressed desire is paramount. The correct answer is A. Conduct a comprehensive risk assessment that integrates objective data, e.g., relapse indicators, support systems, with the client's subjective report of readiness and coping strategies, and collaboratively discuss findings to inform vocational planning. Explanation. This scenario is professionally challenging because it requires the rehabilitation counselor to balance the client's expressed desires with objective risk factors, adhering to ethical principles of client autonomy and professional responsibility to ensure safety. The counselor must navigate potential biases and ensure the assessment is comprehensive and culturally sensitive, aligning with CRCC Code of Professional Ethics for rehabilitation counselors. The correct approach represents best professional practice because it prioritizes a multifaceted risk assessment that integrates objective data with the client's subjective experience. This aligns with CRCC ethical standards that mandate counselors to conduct thorough assessments, consider all relevant factors, and make informed decisions that promote client well-being and safety. Specifically, it upholds the principle of informed consent by involving the client in the process and respecting their self-determination, while also fulfilling the counselor's duty to protect. An incorrect approach that solely relies on the client's self-report without corroborating objective data fails to meet the ethical obligation for a comprehensive assessment. This could lead to an underestimation of risk and potential harm to the client or others, violating the CRCC ethical principle of avoiding harm. Another incorrect approach that focuses exclusively on external indicators, without considering the client's perspective or potential protective factors, neglects the holistic nature of rehabilitation counseling. This can lead to a biased and incomplete understanding of the client's situation, potentially resulting in inappropriate interventions and a failure to address underlying issues, thus contravening CRCC ethical guidelines on client-centered practice. A third incorrect approach that prematurely labels the client based on initial impressions without a thorough assessment demonstrates a lack of professional objectivity and adherence to ethical standards of assessment. This can lead to stigmatization and hinder the development of an effective, individualized rehabilitation plan, violating the CRCC ethical principle of non-discrimination and the commitment to objective evaluation. Professionals should employ a decision-making framework that begins with a thorough review of all available information, including client history, collateral information, and direct observations. This should be followed by a structured risk assessment process that considers multiple domains of risk and protective factors. Crucially, this process must be collaborative, involving the client in understanding the assessment findings and developing a plan that respects their autonomy while ensuring safety and promoting rehabilitation goals, all within the ethical framework provided by the CRCC. Question 7. The analysis reveals that a rehabilitation counselor is working with a client who has experienced a significant vocational setback due to a chronic health condition. The client expresses frustration with their current job search, citing a lack of understanding from potential employers and limited accessible transportation options. Which of the following approaches best reflects the application of ecological models in this rehabilitation scenario? Option A. Concentrating on educating potential employers about the client's condition and the benefits of hiring individuals with disabilities, without directly addressing the client's personal skill development or transportation needs. Option B. Focusing on developing the client's job-seeking skills and resilience to overcome employer biases and transportation challenges independently. Option C. Developing a comprehensive intervention plan that addresses the client's individual skill development, advocates for accessible transportation solutions, and explores workplace accommodations, while also considering the impact of family support and community attitudes towards disability. Option D. Primarily focusing on identifying new job opportunities that require minimal physical exertion and are located in areas with readily available public transportation. Correct answer is B. Focusing on developing the client's job-seeking skills and resilience to overcome employer biases and transportation challenges independently. Explanation. This scenario is professionally challenging because it requires the rehabilitation counselor to move beyond a purely individualistic view of disability and consider the multifaceted influences on a client's vocational success. The counselor must integrate an understanding of the client's immediate environment, family, workplace, with broader societal and cultural factors, aligning with the core principles of ecological models. The correct approach represents best professional practice because it directly applies the tenets of ecological models, such as Bronfenbrenner's bioecological model, which emphasizes the interconnectedness of various environmental systems influencing development and functioning. This approach acknowledges that rehabilitation is not solely dependent on individual skills or deficits, but is significantly shaped by microsystems, e.g., family support, job coaching, mesosystems, e.g., interactions between family and workplace, exosystems, e.g., employer policies, community resources, and macrosystems, e.g., cultural attitudes towards disability, economic conditions. By considering these layers, the counselor can develop more comprehensive and effective interventions that address systemic barriers and leverage environmental supports, aligning with CRCC ethical standards that promote client self-determination and holistic well-being. An incorrect approach that focuses solely on individual skill deficits fails to acknowledge the environmental context, potentially leading to interventions that are ineffective or even detrimental if they do not account for external barriers. This overlooks the regulatory expectation to provide services that are responsive to the client's full life situation. Another incorrect approach that prioritizes only immediate workplace accommodations without considering broader family or community support systems neglects the mesosystem and exosystem influences, thus providing an incomplete rehabilitation plan. This violates the ethical imperative to consider all relevant factors impacting a client's reintegration. A third incorrect approach that solely addresses societal attitudes without concrete individual or environmental interventions would be impractical and fail to meet the client's immediate needs for vocational support, thus not fulfilling the counselor's duty of care. The professional decision-making process should involve a thorough assessment that systematically explores the client's interactions within their various environmental systems. This includes active listening to the client's experiences, gathering information from relevant others with consent, and analyzing how each system impacts their vocational goals and challenges. The counselor should then synthesize this information to identify leverage points for intervention, prioritizing strategies that address both individual needs and environmental supports or barriers, thereby ensuring a client-centered and ecologically informed plan. Question 8. The assessment process reveals a client with significant physical limitations, but also a strong aptitude for creative problem-solving and a history of enjoying intricate tasks. Which of the following vocational counseling approaches best aligns with the CRCC Code of Professional Ethics for rehabilitation counselors in guiding this client toward meaningful employment? Option A. Prioritize immediate placement in roles with minimal physical demand, regardless of the client's expressed interests or creative strengths, to ensure safety and stability. Option B. Recommend extensive retraining in a field that requires minimal physical exertion, but is entirely unrelated to the client's demonstrated creative problem-solving abilities. Option C. Focus on identifying transferable skills and exploring creative or detail-oriented vocational paths that leverage the client's demonstrated aptitudes and interests, while considering appropriate accommodations. Option D. Suggest vocational options that are solely based on the most readily apparent physical limitations, without further exploration of the client's potential for growth or satisfaction. The correct answer is C. Focus on identifying transferable skills and exploring creative or detail-oriented vocational paths that leverage the client's demonstrated aptitudes and interests, while considering appropriate accommodations. Explanation. The assessment process reveals a client with significant physical limitations, but also a strong aptitude for creative problem-solving and a history of enjoying intricate tasks. This scenario is professionally challenging because it requires the rehabilitation counselor to move beyond the obvious physical barriers and identify transferable skills and latent interests that can lead to meaningful vocational outcomes. The counselor must balance the client's current functional capacity with their potential for growth and satisfaction, adhering to ethical principles of client self-determination and promoting independence. The correct approach represents best professional practice by prioritizing a holistic understanding of the client's strengths, interests, and values, aligning with CRCC Code of Professional Ethics for rehabilitation counselors. Specifically, Standard I-A1. A client welfare mandates that counselors prioritize the welfare of the client. Standard I-A1. C. Informed consent requires that clients be informed about the purpose, goals, and methods of assessment and counseling. By focusing on transferable skills and exploring creative avenues, the counselor is empowering the client to participate actively in career exploration, fostering self-determination. This approach respects the client's inherent worth and potential, aiming for a vocational outcome that is not only feasible but also personally fulfilling. An incorrect approach that focuses solely on the most readily apparent physical limitations and suggests only roles with minimal physical demand fails to explore the client's full potential and may inadvertently limit their aspirations. This violates the principle of client welfare by not maximizing opportunities for growth and satisfaction. It also potentially infringes on the client's right to self-determination by preemptively narrowing their career options without thorough exploration. Another incorrect approach that emphasizes immediate job placement in a highly structured, low-skill environment without considering the client's expressed interests or aptitudes for creative problem-solving overlooks the importance of job satisfaction and long-term vocational adjustment. This can lead to client dissatisfaction, high turnover, and a failure to meet the ethical obligation to promote meaningful employment. A third incorrect approach that suggests extensive retraining in a field completely unrelated to the client's demonstrated creative strengths, without a clear rationale or client buy-in, could be seen as inefficient and potentially disempowering. While retraining is a valid intervention, it must be guided by the client's interests and aptitudes, as well as realistic labor market demands, to be ethically sound and effective. The professional decision-making process for similar situations involves a systematic, client-centered approach. First, conduct a comprehensive assessment that includes not only functional capacity, but also interests, values, aptitudes, and environmental considerations. Second, collaboratively interpret the assessment results with the client, ensuring they understand their strengths and potential. Third, explore a range of vocational options that align with the client's profile, considering both traditional and non-traditional pathways. Fourth, develop a rehabilitation plan that is individualized, goal-oriented, and respects the client's autonomy and right to make informed choices. Finally, continuously monitor progress and adjust the plan as needed, always prioritizing the client's welfare and self-determination. Question 9. Market research demonstrates that individuals with disabilities often face systemic barriers in the workplace. A rehabilitation counselor is working with a client who has recently disclosed a disability to their employer and is experiencing difficulties with their current work environment, which they believe are related to their disability. The client expresses a desire for accommodations, but feels anxious about directly confronting their employer about these needs. The counselor's primary ethical obligation is to support the client's self-advocacy and empowerment. Which of the following actions best aligns with the CRCC Code of Ethics and best professional practice in this situation? Option A. Advise the client that workplace accommodations are often difficult to obtain and suggest they focus on adapting to their current role without further requests. Option B. Facilitate a meeting between the client and their employer, providing the client with strategies and support to articulate their needs and discuss potential accommodations. Option C. Inform the employer about the client's disability and the specific accommodations needed, assuming the employer will understand and implement them without direct client involvement. Option D. Directly contact the employer to negotiate accommodations on behalf of the client, explaining the client's limitations and the necessity of specific adjustments. Correct answer is B. Facilitate a meeting between the client and their employer, providing the client with strategies and support to articulate their needs and discuss potential accommodations. Explanation. This scenario presents a professional challenge because the rehabilitation counselor must navigate the complex landscape of advocacy while respecting the autonomy and self-determination of the client. The counselor's role is to empower the client, not to impose solutions or speak on their behalf without explicit consent and direction. The core ethical principle at play is client self-advocacy, which is foundational to rehabilitation counseling practice as defined by CRCC standards. The correct approach represents best professional practice because it prioritizes the client's voice and agency. By facilitating the client's ability to articulate their needs and concerns directly to the employer, the counselor upholds the CRCC Code of Ethics, specifically principles related to client autonomy, informed consent, and the counselor's role as a facilitator of empowerment. This approach respects the client's right to self-determination and fosters their long-term independence and advocacy skills. An incorrect approach that involves the counselor directly contacting the employer to negotiate accommodations without the client's explicit instruction and involvement fails to respect client autonomy. This action could be seen as paternalistic and undermines the client's right to self-advocacy, potentially violating CRCC ethical standards regarding client self-determination and informed consent. Another incorrect approach, where the counselor decides the accommodations are not feasible and advises the client to accept their current limitations, demonstrates a failure to advocate effectively and a lack of commitment to exploring all possible avenues for client success, which is contrary to the spirit of rehabilitation. Finally, an approach where the counselor unilaterally contacts the employer to explain the client's condition and needs, without the client's direct participation or explicit consent, breaches client confidentiality and autonomy, violating fundamental ethical tenets. Professionals should employ a decision-making process that begins with a thorough understanding of the client's goals and preferences. This involves active listening, open-ended questioning, and a collaborative exploration of options. The counselor's role is to provide information, support, and skill building to enable the client to advocate for themselves. When direct advocacy is necessary, it should always be done with the client's informed consent and in partnership with them, ensuring their voice remains central to the process. Question 10. During the evaluation of a client with a recent spinal cord injury, a rehabilitation counselor has gathered results from a functional capacity evaluation, a psychological assessment, and a vocational interest inventory. Which of the following represents the most ethically sound and professionally effective approach to developing the client's treatment plan? Option A. Prioritize the findings from the functional capacity evaluation, as it directly relates to the physical limitations resulting from the injury, and build the treatment plan around these results. Option B. Create the treatment plan based on the psychological assessment, focusing on addressing any identified emotional distress before considering other aspects of rehabilitation. Option C. Develop the treatment plan based on the vocational interest inventory, assuming the client's primary goal is to return to work, and then address other needs as they arise. Option D. Synthesize all assessment results, identify areas of convergence and divergence, and then collaboratively discuss these findings with the client to inform the development of the treatment plan. Correct answer is D. Synthesize all assessment results, identify areas of convergence and divergence, and then collaboratively discuss these findings with the client to inform the development of the treatment plan. Explanation. This scenario presents a common professional challenge in rehabilitation counseling, integrating diverse assessment findings into a cohesive and actionable treatment plan. The difficulty lies in synthesizing information from various sources, each with its own strengths and limitations, to create a plan that is truly client-centered, evidence-based, and compliant with professional standards. Careful judgment is required to ensure that the treatment plan is not merely a collection of assessment data, but a dynamic roadmap that addresses the client's unique needs, strengths, and goals. The correct approach represents best professional practice because it prioritizes a holistic and collaborative process. By reviewing all assessment results, identifying areas of convergence and divergence, and then discussing these findings with the client, the rehabilitation counselor ensures that the treatment plan is grounded in a comprehensive understanding of the client's situation. This collaborative discussion is crucial for client empowerment and adherence to the plan, aligning with ethical principles of informed consent and client self-determination. Furthermore, it allows for the identification of potential discrepancies or gaps in the assessment data, prompting further investigation if necessary, and ensuring the plan is based on the most accurate and complete information available. This systematic integration of data and client input is a cornerstone of effective rehabilitation counseling, as outlined in the CRCC Code of Professional Ethics for Rehabilitation Counselors. Incorrect approaches fail to meet professional and ethical standards in several ways. One incorrect approach might involve solely relying on a single assessment tool, ignoring the richness and complexity that other instruments might reveal. This is a failure to conduct a comprehensive assessment and can lead to a treatment plan that is narrow in scope and fails to address all of the client's needs, potentially violating the ethical principle of competence and the duty to provide appropriate services. Another incorrect approach could be to develop a treatment plan without client input after the assessments are complete. This bypasses the essential element of client collaboration, undermining self-determination and informed consent, and is a direct contravention of ethical guidelines that emphasize client participation in treatment planning. A third incorrect approach might be to prioritize assessment findings that align with the counselor's preconceived notions or available resources, rather than objectively considering all data. This introduces bias and can lead to a plan that is not truly client-centered, potentially violating the ethical principle of avoiding harm and acting in the client's best interest. Professional decision-making process for similar situations should involve a systematic review of all assessment data, followed by a critical analysis of the findings. This includes identifying strengths, weaknesses, barriers, and opportunities. Crucially, this analysis must then be translated into a collaborative discussion with the client, where the findings are shared, interpreted, and used to jointly develop goals and interventions. The counselor must remain client-centered, ethically grounded, and competent throughout this process, ensuring that the resulting treatment plan is individualized, evidence-informed, and respects the client's autonomy. Question 11. The risk matrix shows a moderate likelihood of a client's request for a specific, non-standard ergonomic workstation setup being met with employer resistance due to perceived cost and disruption. The client, who has a documented mobility impairment, believes this setup is essential for their productivity and comfort. The rehabilitation counselor is aware of the Americans with Disabilities Act, ADA, provisions regarding reasonable accommodations. What is the most ethically sound and professionally effective course of action for the rehabilitation counselor? Option A. Inform the employer that the requested workstation is a mandatory accommodation under the ADA and that failure to comply will result in legal action. Option B. Advise the client that the employer is not obligated to provide highly specialized or expensive equipment and that they should adjust their expectations. Option C. Facilitate a meeting between the client and the employer to discuss the client's needs, explain the ADA requirements for reasonable accommodations, and collaboratively explore alternative ergonomic solutions that are effective for the client and feasible for the employer. Option D. Immediately refer the client to an attorney specializing in employment law to handle the accommodation request on their behalf. The correct answer is C. Facilitate a meeting between the client and the employer to discuss the client's needs, explain the ADA requirements for reasonable accommodations, and collaboratively explore alternative ergonomic solutions that are effective for the client and feasible for the employer. Explanation. This scenario presents a professional challenge because it requires the rehabilitation counselor to balance the client's expressed needs with the employer's operational realities and legal obligations, all while adhering to the ethical principles and regulatory framework of the Commission on Rehabilitation Counselor Certification, CRCC. The counselor must navigate potential misunderstandings about reasonable accommodations, the limits of employer responsibility, and the client's right to privacy and self-determination. The correct approach represents best professional practice because it prioritizes a collaborative and informed process by facilitating open communication between the client and employer, and by providing education on the Americans with Disabilities Act, ADA, and its implications for workplace accommodations. The counselor empowers the client and guides the employer toward a legally compliant and effective solution. This approach upholds the CRCC Code of Ethics, particularly principles related to client welfare, informed consent, and professional competence in understanding relevant legislation. It respects the client's autonomy by ensuring they are an active participant in the accommodation process. An incorrect approach that involves unilaterally dictating accommodations to the employer fails to respect the employer's right to determine the most effective means of providing an accommodation, as long as it is effective and reasonable. This could lead to legal challenges for the employer and may not be the most efficient or practical solution for the client. Ethically, it bypasses the collaborative process and potentially undermines the employer's willingness to engage in future accommodation discussions. Another incorrect approach, which is to simply inform the client that the employer is not obligated to provide the requested accommodation without further exploration, neglects the counselor's duty to advocate for the client and explore all reasonable possibilities. This approach may overlook creative solutions or misunderstandings about what constitutes a reasonable accommodation under the ADA. It fails to uphold the counselor's role as an advocate and may prematurely end the accommodation process, potentially violating the client's right to equal employment opportunities. A further incorrect approach, such as immediately escalating the situation to legal counsel without attempting to resolve it through direct communication and education, is premature and may damage the client-employer relationship. While legal consultation is sometimes necessary, it should not be the first step when a collaborative and educational approach has not been exhausted. This bypasses the opportunity for a mutually agreeable solution and can create unnecessary conflict. The professional decision-making process for similar situations should involve 1. Thoroughly understanding the client's needs and the nature of their disability. 2. Familiarizing oneself with the specific job functions and the employer's operational context. 3. Educating both the client and the employer about their respective rights and responsibilities under relevant legislation, such as the ADA. 4. Facilitating a dialogue between the client and employer to explore potential reasonable accommodations. 5. Documenting all communications and agreed-upon accommodations. 6. Advocating for the client's needs while respecting the employer's operational constraints and legal obligations. 7. Seeking consultation or referral when the situation becomes complex or requires specialized expertise. Question 12. The control framework reveals that a rehabilitation counselor is working with a client who has recently experienced a significant physical injury, impacting their ability to perform previous job duties. The counselor needs to select an assessment that will best inform the development of a personalized rehabilitation plan aimed at maximizing the client's vocational potential and independence. Which type of assessment is most aligned with this objective? Option A. An assessment that relies exclusively on the client's subjective self-reporting of their perceived limitations without objective measures. Option B. An assessment consisting solely of standardized tests measuring cognitive abilities and intellectual functioning. Option C. An assessment focused primarily on classifying the client's medical condition and its diagnostic category. Option D. An assessment that measures the impact of the disability on the client's functional capacities and daily living activities, directly informing vocational goals and necessary supports. The correct answer is D. An assessment that measures the impact of the disability on the client's functional capacities and daily living activities, directly informing vocational goals and necessary supports. Explanation. This scenario presents a professional challenge because the rehabilitation counselor must select an assessment tool that not only identifies functional limitations, but also directly informs the development of a person-centered rehabilitation plan, aligning with the CRCC Code of Professional Ethics. The core of the challenge lies in moving beyond a simple diagnostic assessment to one that facilitates actionable interventions and supports the client's self-determination and vocational goals. The correct approach represents best professional practice because it prioritizes an assessment that directly measures the impact of a disability on an individual's ability to engage in meaningful activities, including work. This aligns with the ethical principle of providing services that are competent and relevant to the client's needs, as outlined in the CRCC Code of Professional Ethics, which emphasizes the importance of individualized rehabilitation plans based on comprehensive assessment. An impact assessment, by its nature, focuses on how a condition affects daily functioning and vocational potential, providing the necessary data to tailor interventions and support services effectively. An incorrect approach that focuses solely on diagnostic labeling fails to meet the ethical requirement of providing services that are directly beneficial and lead to measurable progress. Diagnostic assessments primarily categorize conditions, which may be a starting point, but do not inherently provide the granular information needed for planning specific rehabilitation strategies. This approach risks leading to generic interventions that do not address the unique challenges faced by the individual, potentially violating the ethical duty to promote client welfare and independence. Another incorrect approach that relies exclusively on standardized cognitive tests, while useful for understanding cognitive strengths and weaknesses, is insufficient on its own. While cognitive functioning is a component of rehabilitation, an over-reliance on such tests neglects the broader impact of the disability on vocational capacity, social integration, and overall quality of life. This can lead to an incomplete picture of the client's needs and a rehabilitation plan that is not holistic, potentially failing to address critical barriers to successful rehabilitation. A further incorrect approach that uses only self-report questionnaires without corroboration or objective measures can be problematic. While client self-awareness is crucial, Relying solely on self-report may not capture all functional limitations or may be influenced by subjective perceptions. Ethical practice demands a comprehensive assessment that incorporates multiple data sources to ensure accuracy and validity, thereby supporting the development of the most effective and appropriate rehabilitation plan. The professional decision-making process for similar situations should involve a systematic evaluation of assessment options against the client's stated goals and the ethical mandates of the CRCC. This includes 1. Identifying the primary purpose of the assessment, e.g., diagnosis, functional capacity, vocational potential, impact on daily living. 2. Considering the client's specific needs and rehabilitation goals. 3. Selecting assessment tools that are evidence-based, reliable, and valid for the intended purpose. 4. Ensuring the assessment process is culturally sensitive and respects client autonomy. And 5. Integrating assessment findings into a comprehensive, individualized rehabilitation plan that is regularly reviewed and updated. Question 13. Regulatory review indicates that a rehabilitation counselor is working with a client from a cultural background where disability is viewed as a spiritual test or a consequence of past actions, and there is a strong emphasis on family support and community integration rather than individualistic vocational achievement. The client expresses reluctance to pursue independent employment, stating that their primary role is to fulfill family obligations and accept their current circumstances as divinely ordained. The counselor must determine the most ethically sound and culturally competent approach to facilitate the client's rehabilitation. Option A. Focus solely on the client's expressed reluctance to work, documenting this as a barrier to rehabilitation without further exploration of the underlying cultural factors, and proceed with recommending services that align with the client's current stated limitations. Option B. Engage in a dialogue with the client to understand the cultural and spiritual significance of their beliefs regarding disability and explore how these beliefs can be integrated with rehabilitation goals, potentially redefining vocational success in a way that honors their cultural values and family responsibilities. Option C. Advise the client that their cultural beliefs are not compatible with the goals of rehabilitation counseling and suggest they seek services from a provider who better understands their cultural background, thereby avoiding a potential conflict. Option D. Gently challenge the client's beliefs by explaining the benefits of independent living and employment from a Western perspective, emphasizing that personal autonomy and economic self-sufficiency are universally desirable outcomes for rehabilitation. The correct answer is B. Engage in a dialogue with the client to understand the cultural and spiritual significance of their beliefs regarding disability and explore how these beliefs can be integrated with rehabilitation goals, potentially redefining vocational success in a way that honors their cultural values and family responsibilities. Explanation. This scenario presents a professional challenge due to the intersection of a client's deeply held cultural beliefs regarding disability and the rehabilitation counselor's professional obligations to promote client self-determination and functional independence. The counselor must navigate potential conflicts between the client's worldview and the rehabilitation process without imposing their own cultural biases or devaluing the client's lived experience. This requires a nuanced understanding of cultural competence as defined by CRCC ethical standards, which emphasizes respecting client values and beliefs while still facilitating progress towards rehabilitation goals. The correct approach represents best professional practice because it prioritizes a collaborative and culturally sensitive exploration of the client's beliefs and their impact on rehabilitation goals. This aligns with CRCC Code of Professional Ethics for Rehabilitation Counselors, specifically Standard I. A1. A client self-determination, and Standard I. A2. A respect for diversity, which mandate that counselors respect clients' rights to make decisions about their lives and to be free from discrimination. By engaging in open dialogue, seeking to understand the cultural underpinnings of the client's perspective, and jointly developing strategies that honor both cultural values and rehabilitation objectives, the counselor upholds ethical principles and fosters a trusting therapeutic relationship. An incorrect approach that dismisses or minimizes the client's cultural beliefs as irrelevant to rehabilitation fails to acknowledge the profound influence of culture on an individual's perception of disability, their willingness to engage in services, and their definition of success. This violates the CRCC ethical standard regarding respect for diversity and can lead to alienation, mistrust, and a breakdown in the therapeutic alliance. Another incorrect approach that attempts to directly change the client's cultural beliefs or impose a westernized view of disability is ethnocentric and disrespectful, directly contravening the principle of client self-determination and the ethical imperative to avoid imposing personal values. Such an approach can be perceived as coercive and damaging to the client's sense of identity and agency. Professional decision-making in similar situations requires a systematic process. First, recognize and acknowledge the client's cultural background and its potential influence on their rehabilitation journey. Second, actively seek to understand the client's perspective through empathetic listening and open-ended questioning, without judgment. Third, assess how these cultural beliefs might impact the rehabilitation process and collaboratively explore potential strategies that integrate these beliefs with established rehabilitation principles. Finally, continuously monitor the effectiveness of interventions and be prepared to adapt the approach based on the client's ongoing feedback and evolving needs, always prioritizing their dignity and self-determination within the ethical framework. Question 14. Process analysis reveals that a rehabilitation counselor is working with a client who has expressed a strong desire to pursue a vocational goal that the counselor believes carries significant risks of relapse for the client's substance use disorder, based on the client's history and current support system. The client insists on this goal, stating they understand the risks but are willing to take them. What is the most appropriate course of action for the rehabilitation counselor in this situation, adhering strictly to the CRCC regulatory framework and ethical guidelines? Option A. Immediately inform the client that their chosen vocational goal is not feasible due to the identified risks and steer them towards alternative, lower-risk options. Option B. Conduct a formal assessment of the client's capacity to make informed decisions regarding their vocational goal, documenting the process and outcomes, and consulting with supervisors or other professionals as needed to ensure the client's understanding of risks, benefits, and alternatives. Option C. Proceed with the client's chosen vocational goal as requested, trusting the client's judgment and their assertion of understanding the risks involved. Option D. Terminate the counseling relationship due to the irreconcilable difference in professional judgment regarding the client's vocational path, without further exploration of alternatives or referral. The correct answer is B. Conduct a formal assessment of the client's capacity to make informed decisions regarding their vocational goal, documenting the process and outcomes, and consulting with supervisors or other professionals as needed to ensure the client's understanding of risks, benefits, and alternatives. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the rehabilitation counselor's ethical and legal obligations to ensure client safety and well-being. The counselor must navigate the client's autonomy while also considering potential risks and the legal framework governing informed consent and capacity. The challenge lies in balancing these competing interests without compromising the client's rights or the counselor's professional responsibilities. Correct approach analysis. The correct approach involves a thorough assessment of the client's capacity to make informed decisions regarding their rehabilitation plan. This aligns with the ethical principles of client autonomy and beneficence, as well as legal requirements for informed consent. Rehabilitation counselors are mandated to ensure clients understand the risks, benefits, and alternatives of proposed interventions. If capacity is questionable, the counselor must engage in a structured process to determine it, which may involve consultation with other professionals and documentation of the assessment. This approach upholds the client's right to self-determination while ensuring that decisions are made with a clear understanding of implications, thereby protecting both the client and the counselor from potential legal and ethical repercussions. Incorrect approaches analysis. One incorrect approach involves immediately overriding the client's wishes based on the counselor's personal judgment of what is best. This violates the principle of client autonomy and can lead to a breakdown in the therapeutic relationship. It also fails to adhere to the legal requirement of assessing capacity before making decisions on behalf of the client. Another incorrect approach is to proceed with the client's stated plan without further inquiry, despite concerns about potential harm. This neglects the counselor's ethical duty of beneficence and non-maleficence, as well as potential legal obligations to protect the client from foreseeable harm. It also bypasses the necessary steps to ensure the client has truly provided informed consent. A third incorrect approach is to terminate services prematurely due to the disagreement without exploring alternative solutions or ensuring the client has access to appropriate support. This can be seen as abandoning the client and may have legal and ethical ramifications, especially if the client is left in a vulnerable position without adequate resources. Professional reasoning. Professionals should employ a decision-making process that prioritizes a comprehensive assessment of the client's capacity. This involves gathering information about the client's understanding of their situation, the proposed plan, and potential consequences. If capacity is uncertain, the counselor should consult with supervisors or colleagues, seek input from other professionals, e.g., medical doctors, psychologists, and document all steps taken. The goal is to reach a decision that respects client autonomy while ensuring safety and adherence to legal and ethical standards. This systematic approach minimizes the risk of ethical violations and legal challenges. Question 15. The efficiency study reveals that a rehabilitation counselor is working with a client who expresses significant distress and a desire for immediate vocational placement. The counselor has administered a battery of psychological assessments, including measures of cognitive ability, personality, and vocational interests. The results indicate a discrepancy between the client's stated vocational goals and their current cognitive functioning, as well as some underlying anxiety that may impact performance in high-pressure work environments. The counselor needs to determine the most appropriate next step in the rehabilitation process. Option A. Focus solely on the vocational interest inventory, results to identify suitable job matches, disregarding the cognitive and anxiety assessments as secondary to immediate employment. Option B. Discuss the assessment findings collaboratively with the client, explaining the implications for their vocational goals and exploring potential adjustments or supportive strategies to address the identified cognitive and anxiety-related factors. Option C. Proceed with vocational placement in the client's desired field immediately, as their expressed desire is the primary driver for rehabilitation services. Option D. Share the detailed assessment results with potential employers to help them understand the client's needs and potential challenges. The correct answer is B. Discuss the assessment findings collaboratively with the client, explaining the implications for their vocational goals and exploring potential adjustments or supportive strategies to address the identified cognitive and anxiety-related factors. Explanation. This scenario presents a professional challenge because it requires the rehabilitation counselor to balance the client's immediate expressed needs with the long-term implications of psychological assessment findings, all while adhering to CRCC ethical standards and relevant U.S. federal and state regulations regarding client confidentiality, informed consent, and the scope of practice. The counselor must navigate potential biases in assessment interpretation and ensure that interventions are client-centered and evidence-based. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered evaluation that integrates multiple data sources. This aligns with CRCC Code of Ethics Standard I.A.4, competence, and I.A.4b limitations of competence, emphasizing the need for appropriate assessment tools and understanding their limitations. It also upholds Standard I.B.1, informed consent by ensuring the client understands the purpose, nature, and potential outcomes of the assessment. Furthermore, it respects Standard I.C.1, confidentiality, by only disclosing information with explicit client consent and within legal boundaries. This approach ensures that the assessment results are used to inform a collaborative and individualized rehabilitation plan, promoting client autonomy and well-being. An incorrect approach that relies solely on the client's self-report without corroboration fails to meet the CRCC ethical standard of using appropriate assessment tools and may lead to inaccurate case conceptualization, violating Standard I.A.4. It also risks overlooking critical underlying psychological factors that may impede rehabilitation, thus not providing comprehensive services as expected under Standard I.A.1. Primary responsibility. Another incorrect approach that involves the counselor unilaterally deciding on the client's diagnosis and treatment plan based on limited information, without further assessment or client input, violates the principle of client autonomy and collaborative goal setting, which is fundamental to ethical rehabilitation counseling. Disregard standard I. B. 1. C. Confidentiality by potentially making assumptions that could lead to inappropriate disclosure or action. It also breaches standard I. A. 4. By not employing a thorough and appropriate assessment process. A third incorrect approach that involves sharing assessment findings with other professionals without explicit, informed consent from the client, except where legally mandated, constitutes a clear violation of CRCC Standard I. C. 1. A. Confidentiality and potentially state and federal privacy laws like HIPAA. This action erodes client trust and can have severe legal and ethical repercussions. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the client's presenting concerns and goals. Second, selecting and administering appropriate psychological assessments, considering their validity, reliability, and cultural appropriateness. Third, interpreting assessment results within the broader context of the client's life, including their strengths, challenges, and environmental factors. Fourth, engaging in a collaborative discussion with the client about the assessment findings, ensuring they understand the implications. Fifth, developing an individualized rehabilitation plan based on this comprehensive understanding and client agreement. Finally, continuously monitoring progress and reevaluating the plan as needed, always adhering to CRCC ethical standards and legal mandates. Question 16. Implementation of a systematic process to monitor and evaluate a client's progress towards their vocational rehabilitation goals requires careful consideration of various data points. A client reports feeling more confident and capable in their job search activities, citing increased networking and a more positive outlook. The counselor has observed the client engaging more actively in mock interviews and expressing a clearer understanding of workplace expectations. However, the client has not yet secured any job interviews. Which of the following approaches best reflects a comprehensive and ethically sound method for monitoring and evaluating this client's progress? Option A. Prioritizing the counselor's observations of improved interview skills over the client's self-report and recommending advanced skill-building workshops without acknowledging the client's stated feelings of confidence. Option B. Relying exclusively on the client's subjective feeling of increased confidence as sufficient evidence of progress and concluding that the rehabilitation plan is effective based on this report alone. Option C. Focusing solely on the objective outcome of securing job interviews as the primary indicator of progress and advising the client to intensify their job search efforts without further exploration of their current experience. Option D. Documenting the client's self-reported confidence and the counselor's observations of increased engagement, while also noting the absence of secured interviews and collaboratively discussing these findings to adjust the rehabilitation plan. The correct answer is D. Documenting the client's self-reported confidence and the counselor's observations of increased engagement, while also noting the absence of secured interviews and collaboratively discussing these findings to adjust the rehabilitation plan. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing the client's self-reported progress with objective indicators, while adhering to ethical and regulatory standards for documentation and client-centered care. The professional must navigate the client's subjective experience, the counselor's observations, and the requirements for demonstrating progress towards rehabilitation goals. The correct approach prioritizes a comprehensive, multifaceted evaluation that integrates the client's perspective with observable data and aligns with CRCC ethical standards, particularly those concerning informed consent, client autonomy, and accurate record-keeping. This approach ensures that progress is not solely defined by one metric, but reflects a holistic understanding of the client's journey towards their rehabilitation goals, as mandated by the CRCC Code of Professional Ethics. Incorrect approaches fail to meet these standards. One approach might overemphasize subjective client reports without seeking corroborating evidence, potentially leading to inaccurate assessments and a failure to identify underlying barriers to progress. This could violate ethical principles of competence and diligence. Another incorrect approach might solely rely on external, objective measures without adequately considering the client's lived experience and self-advocacy, undermining client autonomy and the collaborative nature of the rehabilitation process. This could also lead to a misinterpretation of progress and a failure to address the client's unique needs, potentially violating principles of respect and dignity. A third incorrect approach might focus on meeting documentation quotas without a genuine assessment of client progress, which is a clear violation of ethical standards related to integrity and professional responsibility. Professionals should employ a decision-making framework that begins with a clear understanding of the client's established rehabilitation goals. This involves regularly soliciting the client's self-assessment of their progress, actively listening to their experiences, and observing their behaviors and skill development. The counselor should then gather objective data through assessments, observations, and feedback from other relevant parties, with client consent. This data should be triangulated with the client's reports to form a comprehensive picture. Documentation should accurately reflect this multidimensional assessment, clearly outlining progress, challenges, and any necessary adjustments to the rehabilitation plan, always in alignment with CRCC ethical guidelines. Question 17. The assessment process reveals that a client with a spinal cord injury has expressed a strong preference for focusing solely on vocational retraining for a sedentary office job, despite significant evidence from the assessment indicating a need for adaptive physical conditioning to improve their functional capacity and reduce the risk of secondary health complications, which could ultimately hinder their long-term vocational success. The rehabilitation counselor must decide how to proceed with the case management plan. Which of the following represents the most ethically and professionally sound approach? Option A. Proceed with developing a case management plan that prioritizes vocational retraining for the office job as requested by the client, deferring any discussion of physical conditioning until the client expresses readiness or their vocational progress is demonstrably impacted. Option B. Immediately implement a comprehensive plan that includes mandatory adaptive physical conditioning alongside vocational retraining, explaining to the client that these services are non-negotiable for successful rehabilitation outcomes. Option C. Discuss the assessment findings regarding the need for adaptive physical conditioning with the client, explaining how it can support their vocational goals and overall well-being, and collaboratively develop a plan that integrates both vocational retraining and physical conditioning, respecting the client's ultimate decision-making authority. Option D. Focus exclusively on vocational retraining for the office job, as this is the client's stated preference, and document that the client refused recommendations for physical conditioning without further exploration or discussion of its importance. The correct answer is C. Discuss the assessment findings regarding the need for adaptive physical conditioning with the client, explaining how it can support their vocational goals and overall well-being, and collaboratively develop a plan that integrates both vocational retraining and physical conditioning, respecting the client's ultimate decision-making authority. Explanation. This scenario presents a common challenge in rehabilitation counseling, balancing client autonomy with the need for comprehensive service delivery, all within the framework of CRCC ethical standards and relevant rehabilitation regulations. The counselor must navigate the client's expressed preferences against the identified needs that could significantly impact their rehabilitation outcomes. The core tension lies in respecting the client's right to self-determination, while ensuring they receive services that are demonstrably beneficial and aligned with their rehabilitation goals, as mandated by ethical practice. The correct approach prioritizes a collaborative and informed decision-making process. It involves clearly communicating the rationale behind the recommended services, linking them directly to the assessment findings and the client's stated goals. This approach upholds the CRCC Code of Ethics, particularly principles related to client welfare, informed consent, and professional competence. By engaging the client in a discussion about the benefits and potential consequences of each service, the counselor empowers the client to make an informed choice, even if that choice differs from the counselor's initial recommendation. This fosters a therapeutic alliance and promotes client engagement, which are critical for successful rehabilitation. An incorrect approach would be to unilaterally decide on the service plan without adequately addressing the client's concerns or explaining the rationale. This could be seen as paternalistic and may violate the client's right to self-determination, a cornerstone of ethical rehabilitation counseling. Another incorrect approach might be to dismiss the client's expressed preferences entirely, focusing solely on what the counselor deems necessary, without exploring the client's perspective or potential barriers to accepting those services. This disregards the client's lived experience and can lead to resistance and disengagement. Failing to document the rationale for decisions and the client's involvement in the process would also be a regulatory and ethical failure, as it compromises accountability and transparency. The professional decision-making process in such situations should involve 1. Thoroughly reviewing assessment data and identifying service needs. 2. Actively listening to and understanding the client's perspective, preferences, and concerns. 3. Clearly articulating the professional judgment and the evidence supporting recommended services, explaining how they align with the client's goals. 4. Collaboratively exploring options with the client, addressing any barriers to acceptance. 5. Documenting the entire process, including discussions, client input, and the final agreed-upon plan, ensuring it respects client autonomy while promoting optimal rehabilitation outcomes. Question 18. Stakeholder feedback indicates that a client in a supported employment program is experiencing significant difficulty meeting performance expectations in their new role, leading to increased anxiety and a desire for the job coach to intervene more directly by completing tasks on their behalf. The job coach needs to determine the most effective and ethical strategy to address this situation. Option A. Immediately take over some of the client's more challenging tasks to alleviate their immediate stress and ensure performance expectations are met, thereby demonstrating the job coach's value. Option B. Advise the client to request a less demanding role or additional accommodations from their employer without first exploring internal strategies for improvement. Option C. Focus on providing constant supervision and direct instruction for every task, ensuring the client completes them perfectly, even if it requires extensive time and the coach's constant presence. Option D. Collaborate with the client to identify specific performance challenges, explore underlying causes, and jointly develop a plan for skill building and strategy implementation, while reinforcing the client's strengths and progress. The correct answer is D. Collaborate with the client to identify specific performance challenges, explore underlying causes, and jointly develop a plan for skill building and strategy implementation, while reinforcing the client's strengths and progress. Explanation. This scenario presents a common challenge in job coaching, balancing the need for immediate client progress with the long-term goal of sustainable employment. The professional must navigate the client's immediate distress and desire for a quick fix while adhering to ethical principles of client autonomy, informed consent, and the promotion of self-sufficiency. The CRCC Code of Professional Ethics emphasizes the counselor's responsibility to empower clients and facilitate their independence, not to create dependency. The correct approach prioritizes a collaborative, problem-solving process that addresses the root cause of the client's performance issues. This aligns with best professional practice by respecting the client's agency, fostering their skill development, and ensuring that interventions are tailored to their specific needs and the demands of the work environment. This approach promotes long-term employment success and upholds the ethical principle of client welfare by equipping the client with the tools to manage future challenges independently. An incorrect approach that focuses solely on immediate task completion without exploring underlying issues fails to address the client's developmental needs and may lead to a cycle of dependency. This could be seen as a failure to provide comprehensive rehabilitation services, potentially violating ethical standards related to client progress and self-sufficiency. Another incorrect approach that involves making decisions for the client without their full input undermines their autonomy and the principle of informed consent. This can lead to resentment, lack of buy-in, and ultimately, a less effective outcome. Finally, an approach that over-relies on external support without empowering the client to internalize strategies neglects the core purpose of job coaching, which is to build the client's capacity for independent functioning in the workplace. This can be viewed as a failure to adhere to the ethical mandate of promoting client independence. Professionals should employ a decision-making process that begins with active listening and empathic understanding of the client's concerns. This is followed by a collaborative assessment of the situation, identifying specific performance gaps and their contributing factors. Interventions should then be co-created with the client, focusing on skill building, strategy development, and problem solving, with clear goals and regular evaluation. The process should consistently empower the client to take ownership of their employment journey. Question 19. The control framework reveals that rehabilitation counselors are obligated to maintain comprehensive and accurate client records. Following a session where a client expressed significant distress regarding a recent job rejection and discussed potential coping strategies, which of the following documentation practices best aligns with regulatory and ethical requirements for rehabilitation counseling? Option A. Delaying the documentation of the session for several days until a clearer picture of the client's long-term reaction emerges, at which point a summary of the entire period will be created. Option B. Briefly noting that the client was upset about a job rejection and that coping strategies were discussed, without detailing the specific strategies or the counselor's reasoning. Option C. Documenting the client's expressed feelings of disappointment, the specific coping strategies discussed and agreed upon, the counselor's rationale for suggesting those strategies, and the plan for follow-up. Option D. Recording the client's emotional state in detail, including subjective interpretations of their demeanor and including personal reflections on the counselor's own feelings during the session. The correct answer is C. Documenting the client's expressed feelings of disappointment, the specific coping strategies discussed and agreed upon, the counselor's rationale for suggesting those strategies, and the plan for follow-up. Explanation. The control framework reveals that rehabilitation counselors must maintain accurate, complete, and timely documentation to ensure continuity of care, facilitate interdisciplinary communication, and comply with ethical and legal standards. This scenario is professionally challenging because it requires balancing the client's immediate need for support with the counselor's obligation to document interactions in a manner that is both clinically relevant and compliant with CRCC standards. The counselor must make a judgment call on what information is essential for the client's record, considering privacy, confidentiality, and the purpose of the documentation. The correct approach represents best professional practice because it prioritizes the client's well-being and the integrity of the rehabilitation process. Documenting the client's expressed concerns, the counselor's interventions, and the rationale for those interventions provides a clear record of the services provided. This ensures that other professionals involved in the client's care have access to relevant information, promoting coordinated services and informed decision-making. Furthermore, thorough documentation is a cornerstone of ethical practice, safeguarding both the client and the counselor by providing a factual account of the professional relationship and services rendered, aligning with CRCC emphasis on professional responsibility and accountability. An incorrect approach that omits the client's specific concerns and the counselor's rationale for intervention fails to provide a comprehensive picture of the service provided. This can lead to gaps in care, misinterpretations by other professionals, and a lack of accountability. Ethically, this omission could be seen as a failure to adequately represent the services rendered and the client's progress or challenges, potentially violating principles of fidelity and competence. Another incorrect approach that includes excessive personal opinions or irrelevant details beyond the scope of professional rehabilitation counseling compromises client confidentiality and the professional nature of the record. Such documentation can be subjective, biased, and may not serve the primary purpose of tracking rehabilitation progress. This violates ethical guidelines regarding privacy and the maintenance of professional boundaries, potentially exposing sensitive client information unnecessarily. Finally, an approach that delays documentation significantly, even if eventually completed, risks inaccuracies due to memory lapses and can hinder timely communication and service delivery. This delay can impede the collaborative efforts of the rehabilitation team and may not reflect the client's situation accurately at the time of service, potentially impacting the effectiveness of interventions and violating principles of timeliness and accuracy in record keeping. The professional decision-making process for similar situations involves a systematic approach. First, identify the core purpose of the documentation to record services, progress, and plans. Second, consider the client's rights to privacy and confidentiality, ensuring only relevant information is included. Third, adhere to CRCC ethical standards and any applicable legal mandates regarding record keeping. Fourth, prioritize clarity, accuracy, and objectivity. Finally, reflect on whether the documentation provides a sufficient and accurate account for continuity of care and professional accountability. Question 20. Investigation of a rehabilitation counselor's approach to a client who expresses a strong desire for independent living following a recent hospitalization for a mental health crisis, but exhibits some disorganized thinking and occasional difficulty with daily living tasks, requires careful consideration of the client's autonomy and safety. Which of the following approaches best reflects best professional practice in this situation? Option A. Conduct a comprehensive risk assessment that includes gathering information about the client's support systems, coping mechanisms, and specific challenges with daily living, while collaboratively developing a safety plan with the client that balances independence with necessary supports. Option B. Focus exclusively on the potential negative outcomes of independent living, such as relapse or self-neglect, without exploring the client's strengths or their desire for autonomy. Option C. Immediately recommend that the client remain in a supervised living environment, citing concerns about their disorganized thinking and potential inability to manage daily tasks independently. Option D. Rely solely on the client's verbal assurance of their ability to manage independently, without conducting any further assessment of their current functional capacity or potential risks. Correct answer is A. Conduct a comprehensive risk assessment that includes gathering information about the client's support systems, coping mechanisms, and specific challenges with daily living, while collaboratively developing a safety plan with the client that balances independence with necessary supports. Explanation: this scenario presents a professional challenge because the rehabilitation counselor must balance the client's expressed desire for independence with the counselor's ethical and professional responsibility to ensure client safety and well-being. The counselor must conduct a thorough risk assessment without unduly limiting the client's autonomy or engaging in paternalistic practices. This requires a nuanced understanding of rehabilitation counseling theory, particularly as it relates to client self-determination and the counselor's duty of care. The correct approach represents best professional practice because it aligns with the ethical principles and standards of the Commission on Rehabilitation Counselor Certification, CRCC. Specifically, it emphasizes a comprehensive, individualized assessment that considers multiple factors contributing to risk, rather than relying on a single indicator. This approach respects client autonomy by involving the client in the assessment process and collaboratively developing a safety plan. It also adheres to the CRCC Code of Ethics, which mandates that counselors protect the welfare of their clients, including taking reasonable steps to prevent harm to themselves or others, while also respecting their right to self-determination. The focus on identifying strengths and supports, alongside potential risks, is a core tenet of person-centered rehabilitation counseling. An incorrect approach that relies solely on the client's stated intent to live independently, without further assessment, fails to uphold the counselor's duty of care. This oversight could lead to a failure to identify and mitigate potential risks, thereby violating ethical obligations to protect the client's welfare. It also neglects the theoretical underpinnings of rehabilitation counseling that advocate for a holistic understanding of the client's situation. Another incorrect approach, which involves immediately restricting the client's living arrangements based on a single observed behavior or a generalized concern, demonstrates a failure to conduct a thorough risk assessment. This approach can be overly restrictive, undermine client autonomy, and may not be supported by evidence. It can also lead to a breach of ethical principles related to informed consent and client self-determination, as the decision is made without adequate client involvement or a comprehensive understanding of the contributing factors. A third incorrect approach, focusing exclusively on the potential for harm without exploring the client's coping mechanisms, support systems, or personal goals, presents an incomplete risk assessment. This narrow focus can lead to an overly negative and potentially stigmatizing view of the client, hindering the development of effective, empowering interventions. It fails to integrate the strengths-based perspective central to rehabilitation counseling theory and practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather information. Collect comprehensive data about the client's situation, including their expressed desires, observed behaviors, environmental factors, and support systems. 2. Assess risk factors. Identify potential risks to the client's safety and well-being, considering both internal and external factors. 3. Identify protective factors. Recognize and leverage the client's strengths, coping skills, and available support networks. 4. Collaborate with the client. Engage the client in an open and honest discussion about the assessment findings, potential risks, and the development of a safety plan. 5. Develop an individualized plan. Create a plan that addresses identified risks while promoting client autonomy and independence, incorporating appropriate interventions and supports. 6. Monitor and reevaluate. Continuously monitor the client's progress and reevaluate the risk assessment and plan as needed.